Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We're with Pam Adkins today. She is an audiologist. We spoke briefly in another episode about children and hearing issues. Today, we're going to be talking about adults and hearing potential for hearing loss and hearing issues. Did you know that about 15% of adults report some kind of hearing problem? That's 48 million people, so it can be quite a few. Pam, what are some of the things that a family can watch for that may clue in that one of the adults that they love is having some hearing problems?
Most of the time it's pretty noticeable, but not always. It's such a gradual thing. It's not like you usually wake up and don't hear the next day. It's kind of come on years after years and kind of slowly worsened. So the person that has it doesn't notice it as much as the family. They're always the first. And most people will say when they come in, I'll ask if they have hearing loss, and they'll say, yeah, I think I'm okay, but everybody mumbles, or if they turn away, or if there's a crowd of people, they have trouble hearing. And if they're hearing loss is due to aging, they usually have trouble with higher pitch sounds, women's voices, children's voices, and so hearing aids probably would help them at that point when they're getting to that. When they're finally coming in, it's probably pretty bad because they usually wait it off, before they go and get checked.
But you don't have to wait till there's a serious problem.
No.
But if you have that mumbling issue a lot, if you need to look at people while they
Yes.
talk, it might be time for a hearing check.
And if they complain of ringing in their ears or stuffiness or fullness, that's something that you should always have checked. Because it may be something as simple as getting your ears cleaned. Some people need to do that every now and again, or making sure they don't have fluid or have had a cold or allergies or something that might have worked into an ear infection or fluid.
Yeah, checking it and stopping the problem before it gets really
too
out of
bad.
hand.
But yeah.
Now, there are activities that adults do on a normal basis that they may not even think about could cause them hearing loss.
Yes.
Let's talk about some of those.
Just your everyday, weekly activities at home. If you mow grass, you should probably wear, the best thing, earplugs work fine, but ear muffs are better usually. And if you're using any kind of woodworking equipment, saws, table saws, anything, if you do something like that, or weed eating, it's loud.
It is loud.
Any of that, you really should be wearing hearing protection because, again, you're going to do it. You might not notice it right away, but eventually you're going to have problems.
And hunting as well.
Even shooting guns, target practice, any of that.
Even concerts, loud music, something you should watch for.
Yeah, concerts are very dangerous because a lot of times, the performers are on stage and that sound goes out, but it's so loud sometimes you can feel it beating on you. And that's dangerous. Now that could leave you with more hearing loss a lot quicker than over time if you go to something like that very frequently.
So should you be wearing, you probably don't want to wear headphones to a concert. That kind of defeats the purpose. But maybe knock it with an earplug. Even sporting events can be very, very loud and cause some temporary hearing damage, but over time, like you said, might lead to more permanent loss.
Yeah, because if you do that repeatedly, it's going to eventually affect you.
A lot of people say, they hear ringing in their ears, and you mentioned something that maybe diet could help diminish some of that ringing in your ears as an adult.
Yeah, as an adult, people who have a lot of tinnitus or ringing, our physicians will instruct them if they check all the other issues out, blood work and everything, and to instruct them to reduce their sodium, their caffeine intake, because things that might not make it go away but can reduce the severity of it. So if you watch your diet with sodium and caffeine, that sometimes will help.
That's interesting. I did not know that before, but a change in diet might diminish that ringing, and that's a big deal.
Yeah.
So you did mention just a moment ago that, sometimes people have more difficulty with higher pitched voices, with women's voices. In those kind of hearing issues. At what point should you give you a clue that maybe hearing aids are your next step?
Yeah. If you're going to family functions and you feel like you're just being left out because you hear people having conversations but you're not following them, that's very common because you can, with low frequency hearing, you hear okay, but your high frequencies are gone. You're missing consonants. So you can get the vowel part of the word, but you're not getting the ending or the beginning, and that makes them not follow that. So hearing aids at that point would be probably very helpful. I mean, the thing about hearing aids is I think people do better if you have appropriate expectations. Because we do hearing testing and fit hearing aids, but also as an audiologist, we have to try to counsel folks to have appropriate expectations. You don't expect it to make your hearing perfect, because it doesn't. It's not a fix, but it is an aid, and they do help. They can be very helpful.
And get you back.
You have to be taught to use them and to get used to them and know what to expect for them to work the best.
And get you back engaging in those conversations and with your family members more.
Right.
Yeah. Well, thank you so much. There's a lot that adults need to be paying attention to. Sometimes your own health gets kind of pushed to the side, and that slow slide with hearing loss is something you need to stop.
Yeah.
And make sure you're taking care of yourself.
Engage, yes, and enjoy life.
Well, some great thoughts for us to carry forward with this. Pam, thank you so much for being here.
Thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.